Dr. Shravanti Reddy, fertility specialist and gynecologist at Shubha Fertility, LV Nagar. So the topic for today's discussion is the risks involved in the fertility treatment. So basically, the fertility treatments are generally from the starting of the treatments, we base natural treatments, and then we start with ovulation, induction, time intercourse, and we have intrauterine insemination, that is IUI, and then in vitro fertilization is IVF. So we'll start with the basic thing we do in fertility clinics is ovulation, induction, time intercourse. So what happens in ovulation, induction, time intercourse is we stimulate the lady with the injections or the basic drugs for the follicle development. And then at the time of ovulation, we do the scan and we tell them to be in a relationship so that the chance of pregnancies are increased. So what happens in the ovulation induction time, what are the risks involved in this is generally it is a very safe procedure. The drugs and the dosages used for the development of the follicle are very safe. Whatever the hormones are produced in the body, we are just giving from outside the body. So the drugs and the dosages what we are giving in the ovulation induction time intercourse and even in the IUI, very safe. And the dosage is also very low. Our aim is only to produce only 1, 2 or 3 follicles, not more than 3 follicles. So the chance of ovarian hyperstimulation syndrome, which we generally aim for more stimulation in IVF, is also very less in ovulation induction time intercourse and IUI. So the risks are very low. But only thing is the patients, what they tend to do is they go more than 12 cycles of ovulation induction. They change the doctor, they take 6 cycles here, the six cycles there with other doctor, and again take a break and they'll go for another cycles. Continuously they'll go for ovulation induction. That is not recommended because see, if the patients have family history of ovarian cancers, they are more prone for ovarian cancers in the later part of their life. So we always tell, don't go for more than 6 to 9 cycles or maximum 12 cycles, not more than 12 cycles for ovulation induction. Other than that, ovulation induction and IUI are safe. They don't have any other side effects. They're pretty safe and fairly safe. And coming to IVF is divided into 3 steps. First step is the stimulation process where we give injections to development of the follicles, and the next step is the egg retrieval process, and next is the embryo transfer. So coming to the first step, it is where we give the stimulation process where we give the injections for the development of the follicles, starting from the day 1 to day 11 or 10, depending upon the patient. So how she responds to the stimulation. So these are the injections called gonadotropins. They are the hormones generally produced in the body. We are giving from outside to give generally whatever hormones are produced in the body, that from our brain. It will help to develop only 1 follicle from the same hormones we are giving from outside, so that in IVF we aim for maximum number of follicles in the ovaries. Like if you have 10 follicles in each ovary, we aim to develop every follicle in both ovaries. That is our aim in IVF. So what happens in the stimulation process is we use a very, very thin needle to give the injections. So the only painful thing is that injection part. That is a very, very thin needle, but still some patients will still complain of pain because of the threshold. Some patients won't have threshold to bear that small pain also, but it's some people won't even complain of pain. That is the only pain we go in the IVF throughout the IVF stimulation. And next comes the some patient even complains of nausea and vomiting through the stimulation process. This is also very rarely seen, but some people still complain, and some people complain of some mild weight gain and bloating. And sometimes even for the injections there can be some bruising. This is a subcutaneous injection. Some people complain of the bruising also. And next comes the egg retrieval process. So egg retrieval process is done under anesthesia, so there is no pain at all. But for the anesthesia, after giving anesthesia, we take a needle, very fine needle, and we through the vaginal wall, we puncture the ovaries and the follicle, and we aspirate the fluid which is in the follicle, and after aspirating the fluid, we'll get an egg in that, and that is separated by the embryologist and then put in the incubator, and then next it is mixed with the sperm to make an embryo. Now what happens after the egg retrieval process is that it is done under anesthesia, so it is safe procedure most of the times. Nothing, no complications. Only thing we see is mild to moderate pain before discharge. Patient will complain of pain, little pain on the day of the retrieval. Next day they'll be fine. And next is when you introduce the needle into the ovary, there are chances of inadvertent injury to the organs when there are additions or there are some complications in that case. But it is very rarely seen, because all the doctors and all the fertility specialists are expertise in that, and there is no chance. Very rarely it is seen, because everybody is expert, very well-to-do practitioners and expertise in that field. So we are not seeing that those complications also in these days. And sometimes we might see some kind of bleeding or hemorrhage while pricking the needle, and that will also settle down. And this is the only thing. And most commonly what we see, we see in PCOS patient is this ovarian hyperstimulation syndrome. That is also very rare. We see ovarian hyperstimulation syndrome is that it is due to the development of follicles. In PCOS, what happens is there are more number of follicles, so they tend to have more. Every follicle is increased, so they lead to it leads to ovarian hyperstimulation syndrome. But most of the clinics are OHSS free clinic in these days, so it is almost less than 1%. We do Antac cycles, so it is completely that is also very rare complication these days. So basically, egg retrieval procedure is also fairly a safe procedure. And next comes the embryo transfer. Embryo transfer, when it comes to embryo transfer, it's a very simple procedure. It is, the embryos are transferred into a thin catheter and introduced into uterus, and it is done without anesthesia because there is no pain in that. And after pregnancy, what happens in embryo transfer is depending upon the patient history before and whatever the clinician decides and what the patient decides according to the embryo grading and everything, there are chances of transferring 2 embryos into the uterus. So the next complication might be a multiple pregnancy. When she becomes pregnant and the two embryos gets implanted, it will turn into a twin pregnancy. So twin pregnancy has a complication, the risk of, it's always a high risk pregnancy, because see, there is a risk of preterm labor, premature rupture of membranes, and cesarean section. So most of the times what happens in IVF pregnancies, when they conceive, they are always considered high risk pregnancies, because they most of the times they have chances of premature babies, and they most of turn into cesarean sections. So these are the only complications we see in the multiple pregnancies and all. Otherwise, IVF is fairly a safe procedure. So no need to worry when you go for IVF. It is always risk-free, and whatever the complications or small risks we have discussed, that is very minute risk we see in IVF. So when you go for IVF, discuss with a fertility specialist to get a detailed evaluation. Don't worry about the risk and all, because you will be safe in the expertise hands. So these are the very minute risks. You can be discussed with all this can be discussed with your fertility specialist. Then you can go ahead. Thank you.